Welcome back to Tales of Truth. I'm Dr. Angie, and this is my veterinary nurse, JoJo, and this is where we tell the truth about veterinary medicine. And today we're going to be talking about itchy dogs. This is one of my favorite subjects, and I could talk for hours about this, but we're going to try to condense it down into some pretty good highlights. So if you have an itchy or allergic dog, this is going to be one you don't want to miss.
I feel like we see more itchy dogs in the practice than anything else. Do you think that's fair?
I think that's true. And I think it's one area where people really shy away from traditional treatments because they feel like they're not really getting to the root cause of the disease and they're just suppressing symptoms. So I think most people that hire us are wanting to get more to the root cause. And I feel like we have a great system to do that, and we see really great results.
We do see really great results with this, and we see it near and far. It's not just patients that you see in Boulder. Like these are some that we see through telehealth.
Yes.
That you're able to manage these cases.
Yes. And I want to start by saying there's so many holistic veterinarians out there that are selling supplements or gut healing protocols to people with itchy dogs. And for the most part, they just don't work. And I see so many people spinning their wheels thinking, oh, if I just can add one more supplement on, my dog's gut's going to heal and they're no longer going to be itchy. And it just does not work like that.
Well, tell me why the initial thought is there's something going on with my dog's gut if he's itchy.
That's such a good question.
I mean, my non-veterinary mind would go, I wonder if she's in the grass. I wonder if, what she's allergic to, like dust mites, but you went to gut.
Yes. Well, I think in the alternative world, it's so easy for people to blame everything on gut health. And I understand why they do that because gut health is so important and influences every other system of the body. So I think it's important, but it's not necessarily the place to start or the only thing to blame. And so I think people waste a lot of time and money trying to heal their dog's gut, and they're not really addressing the root cause. And the immune system doesn't just live in the gut. And so just because your gut's perfect, it doesn't mean your immune system is perfect too. It can be very overactive and you can have decent gut health. And some people are going to disagree with me. So that is definitely a hot take. But I've tried, when I was a baby vet and I just started doing Chinese medicine, a lot of the professors, teachers, people that were giving us this information about Chinese medicine were like, oh yeah, you can use these herbs to fix these allergies. And then I just did it over and over again, and I did not see the results.
And it's really hard to keep practicing medicine in something that's not working.
It's really hard. People get really frustrated and they want to have their dog have symptom relief right away, and their dogs deserve that. And so over the last 18 years, I feel like I've created a really good system that helps get to the root cause, but also rescues dogs from their itchy state. I can't imagine being as itchy.
Right, it's got to be the worst.
The worst.
One of the worst. Do you remember, this is a side note, we had a patient who had like an itch counter. Do you how many times they would scratch in a day, and it had like a...
Were they wearing it like a watch?
It was something that they wore. I don't know exactly how it worked. We never actually got to see it, but she's like, oh, his itches are up by this number. I just thought that was such an interesting...
Brilliant.
So they could graph. Is it seasonal? Is it... What's happening? Yeah, that was a side note because it's just something I remembered.
Yes.
So the protocol, what is it? If a dog came to a traditional vet being itchy, what would the traditional protocol be?
The traditional protocol is about symptom suppression, which I definitely don't want to give symptom suppression a bad name because these dogs need to have some relief from their itchiness. But most veterinarians will say, oh, we can just suppress the symptoms. And there aren't enough veterinarians saying, let's figure out what your dog's allergic to. And dogs can be allergic to things in the environment like pollen, grass, trees, dust mites, or they can be allergic to proteins in their food, whether it be the protein from a carrot or from chicken or from rice. They can be allergic to any of those. And some dogs are allergic to both environmental allergens and food allergens.
The double whammo. That's a little harder to sift apart
Yes.
when that's happening.
I always start with food. Unless my patient has symptoms that are seasonal, I always start with food because that's the first thing we can control. And that's usually where I see the fastest results.
So what I heard you say is in traditional veterinary medicine, they might bring their dog in for itchiness and be given a Band-Aid for that in terms of like probably Apoquel or something of that sort.
Yep.
But if they were to see an integrative vet, well, depending, if they were to see you,
they were to see me,
your first inkling is let's talk about your dog's diet.
Yes. I would be doing a diet trial right away. And I'm not against using some of those symptom suppression medications like Apoquel, like Cytopoint. So I still use those because I need to rescue my patients. But the first thing I look at is let's figure out if your dog has food allergies. And there are a lot of ways to do that. And over the span of my 18 years of practice, I've done them all, but I've kind of settled out into the fastest and the easiest. So when I first started practicing, I would say, let's take out grains. We were really villainizing grains. And, for some dogs, that would actually be quite helpful. And so there were a subset of dogs that would be helped just by taking out grains. We now know we might have introduced some other problems, but that's for another episode. And then I would say, dun, dun, dun. Then I would say I'd take, the next kind of iteration of my practice was like, let's do a homemade limited ingredient diet.
I would hate that.
Yeah, can you imagine if I prescribed that to you, right?
So much work. I just felt the heaviness in my body of the work of that. But I'm always happy when people have the capacity to do that.
Yeah, it's not me. I mean, I've done all of my own elimination diets and they are so time consuming. So I spent a lot of time doing that. And then I spent a lot of time trying different foods or single ingredient. And what I settled out to was my favorite diet, or is my favorite diet.
Hold it. It's a controversial topic.
I know.
What you're about to say. As an integrative veterinarian, you recommend
Ultamino by Royal Canin. I recommend
the gas.
I know. Fire me now.
Or hire you now because it works.
It so works. So for those of you that don't understand hydrolyzed or amino acid-based diets, think of proteins as a string of pearls, and every pearl is an amino acid. And the longer the string of pearls, the bigger the protein, the more likely your body or your dog's body is going to react to it. And so there are some diets that are hypoallergenic diets that they cleave the pearls or the amino acids into smaller groups. And so like HP, I think Royal Canin makes an HP. I don't remember all of their names. And so they'll often use soy, which I'm not a huge fan of anyways. Sometimes they use chicken, and so they call these hydrolyzed diets. And I don't really like those unless I use them sometimes if my patient won't eat an amino acid based diet. But what I really like about Ultamino is that they've taken the diet down to the individual amino acids. And so we can tell if your dog, with probably like 90% accuracy, does your dog have a food sensitivity? And if your dog's symptoms go away while they're eating Ultamino, and only Ultamino, which is like a boring month for everybody, they need to be eating this diet for 4 to 6 weeks. Usually we see results within a couple of weeks. But if they're eating that for 4 to 6 weeks and their symptoms do not change, the cool thing is that we get to abandon food trials and we just get to move on. I've spent so many months and sometimes years with my clients and patients that have just been rolling through diet after diet. And what I love about Ultamino is it makes it fast and easy for us to figure out if food is a component, and then we move on.
So you're using the food as a diagnostic tool.
Yes.
But beyond that, talk about the healing aspect of it, that it actually has healing aspects for the gut.
Yeah. So we know when dogs eat Ultamino for 14 weeks or longer, that there's some aspect of gut healing that happens because some dogs that could not eat a protein before this 14 weeks can eat it afterwards. And so this is where I think true gut healing does begin. When you remove an allergen and you remove the inflammation that it's causing, then the gut can seal up and be healthier.
That seems like a lot of bang in a bag.
I think so. I think it's worth it. And some people are like, I would never feed my dog kibble. And I just invite them to reconsider that their dog might feel better faster. We might get to the bottom of it more quickly, and that there is room and space for gut healing to happen that wouldn't be happening if your dog was eating entire proteins that were continuing to inflame their gut. It doesn't matter how much broth, how much probiotic, how much, glutamine, whatever you're putting down, into your dog's gut to heal it. It doesn't matter how much of that you're doing if they're every day eating proteins that are inflaming their gut.
Well, the tricky part that we hear a lot of is once someone has read the ingredient deck of the Royal Canin Ultamino, it's a little frightening and anti those who are wanting a cleaner diet. But not only that, they'll be like, I really feel my dog is allergic to chicken and this has chicken in it.
Right. And that's fair. And I went through this journey with my own dog, my last pug, and I literally did everything else before I started Ultamino. I tried everything. I cooked for him. I tried all these other commercial diets. I tried raw diets. And it's so understandable to look at an ingredient deck and think, I don't want to do this. But dogs that are allergic to chicken are not allergic to Ultamino because the body does not recognize it as chicken.
Why do you think that more traditional veterinarians are not immediately going to the prescription diet
as a diagnostic
tool?
I'm not sure. I think the conversation takes a long time.
The follow-up.
Yeah, it definitely takes a long time, but I'm not sure. I feel like most practices that I do relief work in are not using Ultamino. They're open to me using it, but I see a lot of hydrolyzed diets offered first. And now hydrolyzed diets do taste better than Ultamino. So if you have a really picky dog, it might be the Ultamino. They won't eat the Ultamino because when you cleave proteins down into individual amino acids, it has kind of like a vitamin-like smell. Have you smelled Ultamino?
I haven't smelled it. And I smell everything, but I have not opened a bag.
Yeah, it's got a funny smell. And so most dogs eat it. Wouldn't you say 90%?
I can't even think of maybe but one or two that have declined. I mean, they've been wanting for other things because it is sad as a guardian when you have to feed the same food over and over, the same bland food, and then come up with creative ways to give it as a treat.
Yeah.
Because it's the only treat they get. So it can feel sad.
It can feel sad. Food is love, and that gets pretty rough. When Pugsley was on it for his food trial, I would mash up the Ultamino kibbles and then add water and then put it in Kongs and freeze it because I felt so bad. But the thing is, it became so quickly worth it because for the first time, he didn't have terrible gas. He felt so much better. His stomach didn't hurt all the time. Like, I don't think I understood how poorly he was feeling until he felt good.
That makes a lot of sense.
Yeah. And then he had more energy. And he was a different dog when I put him on Ultamino. And I wish I would have done it sooner to know.
Right. But you don't know what you don't know.
You don't know what you don't know.
And then once you know, you know.
Yes. And now I can tell everyone.
Yes. So in these situations too, people would not be supplementing. Like, they're really bare bones diet trial.
Bare bones. And if it works, and the symptoms are resolving or resolved, then the next big ask is stay there for 14 weeks. Most people don't make it 14 weeks, but most people make it a long way before we start adding other foods on.
They're always surprised by the first foods too. They're like, oh, wait, what? Just like a vegetable?
I know. Yeah, so after that time, then we add one food per week to see if we can build back an ingredient deck. So maybe if someone wants to feed, a certain wellness kibble or whatever, then we'll start one at a time. Except for the vitamins and minerals, we just put back the food one at a time to build an ingredient deck. Now, most people will do a few ingredients and be like, I'm sorry, I just had to feed the food. And sometimes that works and sometimes it doesn't. But it's definitely a hard, it's a hard test. It's a test of patience in the sense that your dog feels better and you want to get them off of this kibble, maybe for your own philosophical beliefs. And then you have to just go so slowly. And people are like, I just want to be done with this.
I bet. I feel like, though, it's not quite as painful and slow as an elimination diet in which you're just removing everything.
Right.
And trial testing one ingredient at a time. Or I guess you couldn't do it one ingredient at a time, but you're trial testing.
You're trial testing. And the whole time, though, your dog has felt better. And if you do inflame them with an ingredient, you can go back to the Ultamino. And so it's nice because then you have this place where your dog feels good. And then it, space opens up, time opens up for you to figure out the next step. And some people never move on to the next step. Some people say, my dog feels so good on Ultamino, I'm going to do this. And they don't rock the boat.
What did their stools get like on Ultamino?
Yeah, so Ultamino is very absorbable. And so their stools get really small and tan and infrequent. It's kind of like feeding a raw diet. It's a win. Yeah. Every once in a while, we'll have a dog that gets a little constipated. But for the most part, they just have little tiny poops and they're tan. They look like Ultamino. And some dogs do gain a little bit of weight because for the first time, they're really absorbing everything. They have less inflammation in their gut. And so my personal opinion is that's why they gain a little weight. So sometimes we have to reduce the calories or increase the exercise, but not always.
Well, at what point in this, if you're starting here, but the dog actually has environmental allergies, like at what point in the Ultamino trial or the diet trial are you like, okay, it's not actually food? Do you have to go the full 14 weeks or?
No, you just have to go. The dermatologist I think they want you to go 6 weeks. I usually cut it off at 4. And now all the dermatologists are going to be mad at me.
That's okay. You probably ticked off a subset of lots of people. All the holistic people are mad that you're promoting a prescription diet.
I know. Yeah. I want to make everyone's life so much easier. I'm like, I know how to do this easier. This is the ultimate hack. Yeah. So after 4 weeks, if they're not doing better, then we move on and we move on to immunotherapy.
Which it's interesting that you said a dermatologist, which I'm surprised how many people are shocked that there are dermatologists for animals.
I know.
And it's a business. I mean, it is. They are busy.
They are busy. Our favorite dermatologist, Darren Dell at Wheat Ridge, I think has like a 3-month wait list right now.
Often, yeah.
Yeah. So he's booking 3 months out and then you have to be on a wait list if you want to get in sooner. But
which is a long time to wait when you have an itchy dog.
It is a long time.
You could have done a whole trial in your wait period before you've seen Dr. Dell, which is fantastic. You go in with more information.
Yes. You should always do your food trials before you see your dermatologist. They're going to start you there anyways. So you might as well just do it. And what's so great about immunotherapy is that it's actually determining what proteins or antigens your pet is allergic to. So is your pet allergic to pollen, trees, grass, dust mites? And then they're basically creating a little potion that you're either putting under the tongue or injecting, teaching the immune system to not be so overreactive. And while it takes a long time to work, so it can take up to a year to work, it's very effective and it's worth doing if you have the money to do it.
Is it expensive?
I think Yes, I think it is expensive to start with. I imagine
High
this
initially. Yeah.
the skin testing, yeah, just to see a specialist, and then you're doing skin testing, which for a lot of our patients requires a little sedation, and then sometimes they're doing blood testing as well. And so I would say, I mean, I can't imagine you'd get out the door for less than $1,500. What do you think?
I don't know, but this just brought up in my head our insurance conversation. I'm like, I wonder if insurance covers this.
I wonder if, yeah, I would
Immunotherapy.
assume that if it wasn't pre-existing, that insurance would cover it.
Then that kind of makes a win for insurance. Check.
Check.
Because that's I got some talking to after I talked about insurance. So we may
You
have
got
to go
talking
back.
to?
We may have to go back on like other episodes and be like, okay, I've changed my mind. I know I said this. But anyhow, that's another subject for another day. Itchy dogs is a subject for today.
Yes. Yeah. So I think, immunotherapy is worth doing. And I usually do that. Now, some people know if their dog has both. Sometimes we know that there's a food sensitivity, but then there's also an environmental sensitivity. So I don't wait for immunotherapy.
Uh-huh.
And usually we tell people to make their appointment with Dr. Dell now.
Yes.
Anyways.
Even if your dog is better, you can cancel.
You could cancel. Someone's waiting for that spot.
Absolutely.
So,
Yes.
yeah.
I love our itchy dogs because I always feel like, not always, but I do feel that we are going to be successful in helping ease their symptoms and really for life. Like it might get flared, but it's a lifelong, like their whole life got better. The extension of their life got better. It's just, I don't know. It's always a feel good moment.
Yeah. And if you do have to use immunosuppressants, like symptom suppressors like Apoquel and Cytopoint, I think what I want people to understand is that those medications are so much safer than the medications we used to use. And I don't want them to be scared of using them when they need to. They're so much safer. Everyone's like, oh, I don't want to, the long-term effects of some of these haven't been studied. But yes, they have. And with every, Apoquel is safer than steroids. Apoquel is safer than cyclosporin. Cytopoint is safer than Apoquel. Like we have come so far in kind of getting more specific about how we are stopping your dog from feeling itchy. So instead of suppressing the immune system across the board, we're getting very particular. So we see less side effects and less like overall immunosuppression.
But how about over the counter in terms of on an as needed basis, like a Benadryl type? Is that very effective?
It's really not. I think there are very few dogs. They are out there, but there are very few dogs that respond to antihistamines like we do. And it's so unfortunate. I think Benadryl could work a little bit only because it's sedating.
So it's just kind of slowing down the itch rather than, is that what you mean? Like it's just soothing the whole system.
Yeah, just making your dog
soothing the
sleepy.
wrong word.
Yeah.
like they're too tired.
Yeah, they're too tired. Yeah.
Just scratch. They're going to sleep through the itch.
They're going to sleep through the itch a little bit more. I mean, we've definitely over the years had some patients that do well on the newer generation antihistamines like Claritin and those sorts of, what's the one that begins with a Z?
Zyrtec?
Zyrtec. Yeah, that's the other one that some dogs do well on, but for the most part, they don't.
Okay, that's good. I feel like when I first was out of school, that was the go-to.
Yeah.
It's just like, just go to Walgreens and get your Benadryl.
Yeah, no, it just doesn't help so much.
Well, I'm glad we have more tools.
We have more tools. And if you are listening and want to learn more about itchy dogs, I have a course at boulderholisticvet.com that you can buy. And I take you through my whole system step by step. And if you have any questions about your itchy dog, feel free to leave a comment wherever you are watching this. And we'd love to hear from you. Anything else, JoJo? Anything else we need to talk about?
I feel like that topic is endless.
It's endless.
Again, this is a subset of that. And it was fantastic. That's a great place to start talking with your veterinarian.
Yes, absolutely. Okay, well, be sure to give us a review. We really depend on the feedback, and we appreciate you helping us get more listeners. And we will talk to you soon. Bye.
Bye.
Dr. Angie again. A little PS to this episode. I wanted to remind you that I have documented my entire holistic approach to the itchy dog in an online course. If you go to my website, boulderholisticvet.com, go to my course page, and you can see my holistic approach to the itchy dog, and it can be yours today for free using the code TRUTH. That's TRUTHTAILS. Stick it in your cart and use the code TRUTHTAILS to get it for free. Talk to you soon.